you've emphasized that every minister, every commissioner is the commissioner of health. How true is this statement when it comes to putting it to work? Because I know that, how are you going to feel if you go to an interministerial conference and then health is trying to pull 80% of the budget, and agriculture will just say, yes, I am also commissioner of health, so let him take. Is that what happens there? So tell me the kind of challenges you face trying to, make this happen.
Yes, thank you very much. Yes, yeah, on the right track. But before I do that, I just want to collaborate what Banji, the TA to the minister, has said relating to our fairly, I would say, very good relationship. All states in Nigeria, and I'll say especially also my own state, Niger State, have had a very good working relationship with the Ministry of Health. I don't know how it used to be in the past, but under Professor Isaac Kwaloronsho Adewale, the relationship has been very, very strong. The Ministry of Health has been able to, in terms of issues of financing, help states to assess, each state in Nigeria have assessed $1.5 million. All the 36 states, what they refer to as the Save 1 Million Life Funds program for results that's been expended on the primary healthcare, at the primary healthcare level. All states have assessed that. My own state, Niger State, have also benefited from the operationalization and pilot study for the basic healthcare provision, what referred to as basic healthcare provision fund, in trying to operationalize the National Health Act. 3 states are benefiting from this: Niger State, Osun State, and Abia State. We're going to be getting about 1.5 billion naira. We'll also pay a counterpart fund to this fund in order to also further strengthen the primary healthcare level. Through the Nigerian Center for Disease Control, we've had 2 outbreaks recently, the meningitis outbreak and Lassa fever outbreak. We had the minister come down to our state during these outbreaks. And then also Dr. Chikwe, the head of the National Center for Disease Control, also came down to give us support. They support us with drugs like ribavirin and so on and so forth. And the National Primary Healthcare Development Agency also, there is a good collaboration. Now, coming down to specifically to your question, yes, there is always, for the government, always competing demands for resources that comes to that the states have. And it's always a challenge to try and defend what should come to health, even the 15% allocation that we request for from health. Because like I said, most of all these other ministries will also defend the fact that what they are doing also affects health. But more importantly, what really causes more challenge for the health sector is actually the people themselves, the people at the community. Their understanding of what is their need and what are the things that are top priority for them. I don't know for other parts of the country, but I'll give an example for my own state in Niger State. Recently, the governor of Niger State, Raja Abubakar Sani Bello, did a midterm tour where he went around all the local government after his 2 years in government, one, to see the projects that he's doing. Are they being done? To also further engage with the people to see what they feel about his government in 2 years, and then what are the things that are still pending that they want to be addressed. Now, 5 commissioners were with him: health, education, local government, agri, and works. Now, when we go to the community and the governor is asking them what are their challenges and what are the things that bother them more, some of the things that are in top priority for them when they start mentioning water is number 1. They mention roads, and then surprisingly, in many places that we went to within our communities, mosques. They'll talk about that they want a mosque. Most communities have started even building their own mosques, and they'll tell you that they want the governor to complete it for them. Then the issue of light. At one specific place, when the governor went to a place, he now said something. He said, in Hausa, who harkan rashin lafiya fa? Aren't you bothered about the issue of health? And then the community leader then said, yes, we are bothered about the issue of health. And the governor said, but you people have not mentioned it. Then the community leader laughed and then pointed at one man there, the traditional medicine healer there, that yeah, it's a problem, but this man is already taking care of some of our problems. So yes, there is that kind of challenge. So for the governor himself, when he comes down, he's looking at felt needs. these are what the people are raising up, and this is what will earn you more votes. But we know that without health, you cannot do anything. You cannot exist anywhere. And the governor said to him, "Ama in house, you can't life about harka. If there is no health, you can't do anything." So yeah, there are those challenges that we face. But nevertheless, most of our colleagues are aware of the fact that health is very, very important. And in my own state, I get the support that I need from them when it comes to these kind of issues. Thank you very much.
Thank you so very much. Very wonderful experience there. Now, in Nasarawa State, Dr. Daniel, what challenges do you face, both in the past and now, in trying to push for more allocation? You shared with us in the morning how the budget you had earlier was 4%, and when you came in, you pushed it for 10 point something or thereabout. So, what challenges did you face in doing this, knowing very well that there are competing demands, and we keep hearing from the state that the resources are simply not there?
Thank you. There are challenges, of course, in terms of funding. But I think that just as my colleague in Niger mentioned about the collaboration interministerial, in Nasarawa State, there is an understanding, from my colleagues at the council, executive council. But just, I'll give an example, Niger guy gave an example where health was not put as a priority by the community. On the other hand, I went to a community where, as a result of communal clash, the general hospital was vandalized, was destroyed. It took us quite some time to get there, not because it was far from Lafia, but because the road was in bad shape. Getting there was an issue. When we went there, I found that the primary health center was pretty good, delivering primary care pretty efficiently. And when I came back, I said to my governor, I don't think building or repairing that general hospital is the priority. The priority is access. Because with the functional primary health care, there is a hospital which is just a few kilometers away, Nasarawa gone. So if we prioritize road, rather than spending another billion saying you're going to put up a hospital, that security is not there and could readily be, vandalized again, then we haven't achieved what we were trying to achieve. So there needs to be that understanding. There is competing demands, but there is an understanding of what the role of health plays, and all the ministries understand that. One of the frustrations that I noticed from the cancer, panel this day was the fact that here you saw people with such passion, especially the guy from the National Hospital who is in the radiology department. Yeah. And I said to myself, this guy is doing all his best, and yet the structure, the system doesn't allow, it's not his fault. It's not even the fault of the Honorable Minister of Health. But the fact that you cannot effectively put that kind of system that kind of a service in a system where your electricity is not dependable. You cannot depend on electricity. So there are certain basic infrastructural needs that are needed for the system. And we haven't mentioned this. I think we need to mention it clearly. Corruption affects every part of the system in this country. And we see that manifested also in health sector.
Thank you.
Thank you, sir.
Very much. I will stay with Nasarawa State. Your ministry is responsible for budget, right? So usually when you send the budget, in the budget process, you send out your circulars with an envelope to other ministries. And when you receive them back, what usually is your psychology in trying to allocate funds? Do you have anything for health, or you are being influenced by something else?
No, we have, when we send call circular to ministries to submit their proposals, they bring their proposals, we call them to come and defend these proposals. At the course of our discussion, there are areas that we need to increase their funding. There are areas that we feel, well, this area you have not spent any money, so it is a sign to us that maybe you don't have the capacity to spend, so we can reduce it. But essentially, we take health as a very important issue, and His Excellency has been emphasizing, he gave us a ceiling that health sector should be given a priority. So no matter what, we give priority to health sector.
Okay, thank you so very much. And very distinguished participant, will now come to you because it is not meant to be a one-way traffic. It's going to be both ways. So we'll take questions now from our esteemed participants. All right. So the person at the very back, you're number one. You're number one. Then the guy in front, you're two. You have three in white. Madam, you are number 4. I know if I don't take your own, I'm not going today. You're 5, 6. Comrade, you're 6. Any hand on this row? Okay, 7. And we are good. All right, so please, there will be no preambles, no narratives, no commentary. It's just your submission, straight to the point. Our communicate people, repertoires, kindly get your work ready, because after the response, we'll be inviting you to make your first presentation. So let's have number 1. She's at the back. And I'd like you to come to where camera will see you, Ma. Let's be sure who is talking.
Yes. Good afternoon. My name is Chika Ofo, co-chair for Track Health. My question is simple. So much has been done in the CSO world and then with international organizations, everybody's supporting, but still the coverage level is going down. Now, the commissioner in Niger State has also told us now that he has had some support, 1.5 billion from JFF. I really want to know what he's going to use the money for. It will help us to know, and then how the CSO can also come in to track, because the organization, the coalition that I co-chair, we track funds. So really want to know what, and then the SMOL, Save 1 Million Lives, 450 million. We also want to know what the money has been used for or is going to be used for, and how as CSOs we can come together to also track that money and any other monies that have come to the states. I think
thank you
that's
very
really
much.
what I want
Number
to know.
2. Number 4 now, right?
Good evening. My name is Jane. I represent caregivers. I work in National Hospital and I work directly with cancer patients. And our concern today, we've heard the survivors, their stories and all of that. Now we're leaving this meeting. What are we taking back? Are the machines, the radiotherapy machines, are they going to be fixed? Or will our patients still go to countries like Ghana, like Kenya to seek medical help? We would not do any good to the patients if we go back to the hospitals and tell them, okay, we were in a conference, we talked about you, and it ended there. I want the reps of the minister to give us a commitment. Are we going to fix our machines? One of the survivors gave an example of how the airport was fixed in 6 weeks. And if that is attainable, given the billions it took, it's also possible to fix at least 2 of the 6 machines that are supposed to be in the 6 geopolitical zones. Thank you very much.
Thank you very much. Number 5, just behind her, all right?
Okay, I have 2 questions, and I think I'll direct one to the representative of the minister. I would want to understand how the TSA affects the whole issue of funding, and how we can go about it to restructure it in such a way that even though we're talking of accountability, it doesn't also become a hindrance to achieving what we want to. That's on the one hand. On the second hand, when we look at the issue of funding, we see a lot of donor funding in health in the country. And this comes from the Western world, so to say. We have wealthy Nigerians. Is there any structure that looks at engaging those we can call, aside from Aliko Dangote for now, how many Nigerians who have the wherewithal are actually coming out to set up, to start doing what Bill and Melinda Gates, Aliko Dangote, and so many other donor agencies or organizations are doing for our country?
Thank you.
Thank you very much. Significantly, we have like two types of interministerial relationship, which it has to do with one, a particular ministry having a content of another ministry, like a ministry of health having a content of Ministry of Works, like they want to build a hospital. So in that, this will complement another. And also there's this relationship also in such a way that one ministry needs another ministry to finish its works before it started. So I want to ask, and we understand over time that if this relationship is maintained and is effectively and mutually exhausted, it yields a result. But at times, there is this personal problems between the head of the ministries or head of the prestataries. That's why that ministry, such a relationship is not utilized. So I want to ask the head of our ministry seated here, what usually used to be the problem that relationship is not utilized?
Okay, thank you very much, comrade. And I think the question we have on Twitter is a lot of discussion speaks to allocation. How is budget performance? Maybe like how, allocations has been done, how have you utilized those allocations to solve the problem? So we just run from here, from the Dr. Banjo representing the, oh, there is more. Okay, yeah, I recognize her, please.
Good afternoon once more, everyone. I'm Hawa Kulu Ibrahim, as usual. I work with Fund 1, Federation of Muslim Women Association, as a National Health Project Coordinator. I want to thank the panelists for the knowledge thrown to us this afternoon, most especially the Commissioner for Health, Niger State, and Commissioner for Agric. You have just told us that Agric is health. And also the Commissioner, Niger State, had also told us that all the ministries have link to health. Coming to that, having said that, during the cancer review this afternoon, and also on WhatsApp, I read that cancer is just like scurvy. Somebody was writing that it was like scurvy when scurvy was detected, and later found out that just vitamin C that was the cure. And the cure for cancer, or the preventive measure for cancer now, is vitamin B17. And what's this B17? You said fruits and vegetables. If Agric is health, as you have said, and to eat these vegetables and fruits, as he said, is very expensive. As an Agric commissioner, please, how can we get this available to the grassroots, or make it affordable also, so that we could be able to eat these things in abundance to prevent this harmful disease?
Thank you very much. So over to the panel. 1 minute to respond to as many questions as you want to respond to. What our agreement is 1 minute.
Okay, thanks, moderator. I may not be able to do justice to all the questions if you do tell me to take 1 minute. So wherever I stop, then I can probably move forward. I think the first question that came to me wanted to understand, sort of like mechanisms for results with regards to the budget. The way to look at it is, recurrent versus capital. And this is not a sectoral related issue. It's national, right? And then if you look at 2017, for instance, the broad budget that goes into capital expenditure is smaller than what goes into recurrent. The implications of this, if you decide to move that around, is that a number of people would have to go from the civil service, and that's not something that we want to do at the moment. But even within the capital, the question then becomes, how do we ensure that they are properly well utilized? And I think it boils down to the budget formulation process. There's what you have at the Ministry of National Planning, which is what they consider KPIs for sectors in terms of what you want to achieve. But even within the Ministry of Health, and I'm sure that a number of us who work with us there's what we have at the national level, which is the National Strategic Health Development Plan, which allows you to set your priorities and know what specific goals and objectives you want to achieve. Drawing from that is the medium-term sector strategy, which will involve all partners, right, to help develop, from which your national annual budgets do come into play. And so if all of this is put together and well done, then it's easy to be able to track results. So I just wanted to answer on that. There's a question regarding, how are we able to allow states better understand not just what the federal is doing, but also for states to learn from each other. Recently, we developed something called the Joint Learning Network. It's a global platform that we've adapted to suit local needs. And what is essentially the Joint Learning Network does is that it's a platform where, for instance, if Niger is doing very well and there's something that Nasarawa needs to learn, then they have that platform to be able to learn from one another. Ditto for if Nasarawa is doing well and Ekiti needs to learn. And that was launched about 4 weeks ago, if I'm correct. I'm sure a number of states were very heavily involved in this. So I'd encourage you to also, I can share the website at the end of the day, but I can encourage people to participate in that. On cancer, I think that this is something that is extremely dear to the Honorable Minister's heart. He has always talked about it, particularly given that, even though he's a professor of obs and gynae, his core specialization is in oncology. And I think the way to look at it is take a step back and look at why what we've done in the past hasn't worked well. And then how do you address that so that you can move forward clearly? In 2017, we have a budget of about 9 billion, focusing on ensuring that we improve existing institutions within Nigeria, but with a core focus on oncology. Well, if you look at 9 billion, it looks like huge amounts of money, but that's just $30 million. It's not going to do much, right? In reality, if you really want to build or if you want to put together suitable centers to be able to address the needs of Nigerians. And so what the minister has done is engaging with the Nigerian Sovereign Investment Authority, the NSIA, which is the Sovereign Wealth Fund in Nigeria, is how do we, pool additional resources. The NSI is also going to put in resources into this. So we're mobilizing private sector resources. The goal is to ensure that we bring in also private sector expertise to be able to administer and run these institutions, even within existing ones. But more importantly is, making sure that the costs, for delivery for each patient in whatever form of a service that is rendered is good enough that would be able to address, that's not over the top. So it may look as if it is slower than we would have loved it to, but in reality there's something on ground, and the goal is to ensure that we move forward and be able to ensure that everyone in Nigeria who needs to have care for cancer can get it inside the country. The role of TSA and funding. I think that the way to look at TSA is that, generally speaking, TSA just gives you a good grasp of all the monies that come in. So it's just a window for everybody to be able to see what comes in and what goes out. So in the past, whereas you'd have maybe a ministry, a department, or an agency, that particularly those who generate revenue, keep their revenue, and government doesn't have a good overview of what obtains. What the TSA does now, right, is that it gives the Office of the Accountant General, it gives the CBN a good grasp of how much comes in from everywhere it's coming in. And the way it has now been put together is it has less implications on how ministries are able to draw down. If CBN pays, or if the Office of the Accountant General pays into a ministry's account, based on what the ministry wants to do, right, the ministry can draw down from that account, but government is able to see because they have a good overview. On donor funding, I think the two ways to look at donor funding, as a percentage of total health expenditure in Nigeria, is actually less than 10%. But the thing is that they typically have been sort of like the driver to unlock the critical areas in health, and that's the big thing about donor funding. The question about how do we mobilize, Nigerians within, I think there are a lot of Nigerians beyond Dangote that are already doing different kinds of work in the healthcare space. There's a Private Sector Health Alliance of Nigeria that, that has, although Dangote there, but also has 3, 4 other big Nigerians who have contributed money to look into how to unlock private sector capital to support primary healthcare in Nigeria. There is the Elumelu Foundation, and I'm aware of the Gowon Foundation, I'm aware of the Danjuma Foundation, who are doing different things within the healthcare space. It may be in selected states, but there are all sorts going on. Maybe the question is, how do we provide a platform, to bring all of them together? And I think that's what the Private Sector Health Alliance is really doing. The final question that probably relates to me before I pass it on will be sort of like budget performance. I think it's a good question to ask. It's one thing to have a budget, is another thing, whatever the appropriation is, another thing for it to have been released, and I think another issue for it to be utilized. The big problem is not necessarily in utilization, is the gap is always between appropriation and release. And the challenge again there is not central to health. It is the reality on ground, which is that there are fiscal constraints in Nigeria, and government would have to prioritize its expenditure based on whatever is available. Thank you.
Thank you very much, Dr. Banjo. Dr. Daniel, please.
I'll just speak on a few that have not been touched already by the Honorable Minister. And the first one is the issue of how we're doing with funding. Because a lot of emphasis has been placed on not adequate funding, but I think it's important that whatever we get, no matter how small, is how are we using it. And that's the role of the CSO in terms of tracking. Earlier when it was mentioned that maybe some of us are not open, to that kind of holding us accountable. It's not whether it's not, the question of we like it or we don't like it. We have a responsibility to the people. And it is right for the CSOs to insist on knowing what is going on. And tracking needs to be done. The issue of SML, for example, that was raised, it's going to be like the PBF, performance, based financing. I did mention, I think yesterday, that Nasra said it's one of the states that has some experience in terms of performance-based financing, because the emphasis is on indicators. There are measurable indicators, even at the facility level in primary health care. Number of attendants, immunization, your drug stock out, and all of that. And there are verifiers which are different from us, from the Ministry of Health, independent verifiers who go and check these things and give a report. And in fact, if you're doing well, you will get more money in terms of investing into the facilities. So that is on ground, and that's what SML is going to do as well. The 71 million lives. So there is in place, and I think I will encourage the CSOs to do the tracking themselves and also compare it with the reports that that come from the verifiers. The issue of human resource for health, we talked about it as well. This is again where there's need to have an interministerial as well as federal ministry and the state ministries of health. I did give an example of where you have concentration of doctors in Federal Medical Center, PACFaH, whereas our general hospitals are staffed of doctors. One of the reasons was because the CONMES was not fully implemented. It is now fully implemented. But all the same, there is need for a close review. I mean, you cannot insist that a person must go to where he doesn't want to go. But of course, there are ways in which you can motivate people to go to these places. So the issue of the screwed distribution of manpower is very relevant. And lastly, the issue that was raised by Musa, I believe, in terms of personality issues. This is a reality, not only interministerial, but even within the ministry. And my take on this is that we do not have a common goal or common objective. Most of it is because I'm thinking of myself, what is in there for me, rather than what is of common good to the community. It's not my interest. What is uppermost is what goes to the community and why we are where we are. We are in hospitals because of the patients. We are in positions of authority because it's a trust we are there to discharge it. And unless we see it in that context, self is removed, and the common good is the thing to look at, that kind of problem will persist.
Thank you very much. A resounding applause for our panel. Please clap for them. They have done very well. Right now, please, you remain seated because we are rounding off shortly, so you will just have the privilege of remaining here. Eh? Thank you very much. Yes, because all of you are stakeholders, and you are the true owners of this dialogue. Let us now invite our repertoires and to present the communique, and the rule will be after she presents the communique, we will now have observations from those who participated yesterday and today on what you think they didn't capture well or what you think they should add, and that 1, 2, or 3, 4 people will make that observation. Then the House will move to adopt the communique as amended so that they will go and make the correction and then start a circulation. So we will not wait for another round of reading corrected version. Is this a deal? Let's now join hands together and make welcome Ms. Yai Bete W., who will present the communique of the outcome of this particular National Health Dialogue 2017. Please put your hands together for her.
Good evening, everyone. I'll be presenting the National Health Dialogue Communique. Sorry? Okay, sorry. I'm so sure. Okay, sorry. Okay, so beginning with the introduction, it says the first National Health Dialogue was organized by Premium Times Center for Investigative Journalism, Project Pink Blue, Premium Times, PACFaH, and supported by the Bill and Melinda Gates Foundation. It was a 2-day meeting that occurred on the 24th of August and 25th of August 2017 at the Musa Yaradua Center in Abuja. The overview. The National Health Dialogue was organized for policymakers, patients, state ministries, development partners, community leaders, and CSOs/NGOs to engage in discussions on the challenges and prospects of universal health coverage in Nigeria. It started off with a welcome address and continued with goodwill messages delivered by representatives of the Bill and Melinda Gates Foundation, Premium Times Center for Investigative Journalism, PACFaH, and Project Pink Blue. The Emir of Kano, His Royal Highness Mohammed Sanusi II, heavily represented by Umar Bala, in his keynote speech, emphasized that the government should recognize and work with the traditional and religious rulers to create awareness to the uneducated about the primary health care. The opening session ended with a special remark by the Minister of Health, Professor Isaac Adewale, who stated that more money is needed for the rehabilitation of existing health infrastructures for primary health care to be available and accessible to all. After the presentations and panel discussions on the barriers to actualizing universal health coverage, lessons from the PACFaH, Project Advocacy, and action plans towards the improvement of cancer survivorship, the participants recommended that 1. Stakeholders should conduct constant dialogue to harmonize their positions as health advocates so that the health sector can move forward. 2. Mental health treatment and provisions for persons with disabilities should be included in the services covered in the National Health Insurance Scheme. 3. Establish laws that are contradictory to new bills raised towards the achievement of a universal healthcare system should be repealed. 4. With the recognition of the cultural and religious challenges Family planning advocates should be concerned with child spacing and the health of the mothers and babies rather than population explosion. 5. Mandatory contributions such as taxation should be considered as an alternative for getting the necessary funds for proper health care in states and for the agencies. 6. CSOs should develop and review policies with consideration of the dynamism of our political scene. Sorry about that. 6, 8, 7. Strategies such as tax shifting, LGA recruitment, and undertakings should be implemented to address skilled distribution of health workers. 8, there is a need to engage and educate community members so that they can hold their leaders accountable. 9, the appropriation of funds in the national health budget for there should be an appropriation of funds in the national health budget for cancer care and treatment. Thank you.
Please clap for her now. Those at the back, can you clap for Miss Bethel? Those at the back. Thank you very much. I will just take one or two observations. And also, I've been told that this will be sent to our emails for us to make personal contribution or input into the communique on or before the close of business on Tuesday. And that all those inputs will now be finalized into the final communique that will go out. So let's have just 2 inputs because you still have opportunity to make input. So I'll take you, Madam, 1, and Doc, 2.
Good afternoon, everybody. I made mention in the morning of one of the leading diseases that is attracting medical tourism. Permit me to call it the big brother of cancer. That is kidney failure. I use the word end-stage renal disease. Maybe a lot of people did not understand me. So nothing is mentioned.
Okay, so.
And then the second one, another group of vulnerable people are the aged, geriatrics. Nothing is mentioned about them. What plans do we have for them in our country? Thank you.
And I know Comrade was raising his hands because he didn't mention the issue of people with people that are physically challenged, right? Okay, it was mentioned. So you are good. Another thing, you make it in the input.
I want to thank the rapporteur and the panel for doing justice. However, the representative of the president, the vice president was here, and not mention of his representation.
Okay.
Yeah.
Okay, please, Dr. Osito Okechukwu, who represented the vice president, was here. Capture it. I will now invite Dr. Fatai Aremo to give us the vote of thanks from PACFaH. Please put your hands together for him. If you know you did not register and you're afraid you won't get the email, please go outside and do so. Those at the back raising hands. Thank you.
Thank you very much, MC, for doing a very wonderful job since yesterday. So, all is well that ends well. Universal health coverage is a critical issue in Nigeria. But as he kept repeating since yesterday, together, we win. Together, we win. Together. We win. So this means that we still need a lot of education. We need sensitization. We need mobilization so that all of us can be on the same page so that together we can win. However, something that is actually apparent in the conversation, especially emphasized by the commissioner from Nasarawa, is the point that there is still a lot of ground to cover in terms of this togetherness between the federal government and the state governments, between the ministries of health and their counterparts in other ministries, between the executive and the legislature, between the government and the civil society, between the civil society and the media, which means that this kind of dialogue is very important. We have to keep it going, we have to make it consistent, we have to make it regular. At this point, I want to thank everybody that came. All of us are busy in our respective domains. The Vice President made commitment from the very beginning that we started planning that I was going to be here. Although he couldn't make it, he made sure he sent somebody to represent him. We thank him very much. Please, let's give him a round of applause. Then the Honorable Minister, Federal Ministry of Health, a very passionate person. He made sure he came, he stayed for a very long time, and made a very, very impactful presentation. We thank him very much for that. Senator Mao Hoabunwa, the chairman of the Senate Committee on Primary Health Care, because they are on recess, that's why the National Assembly members were unable to make it. Some of them actually called personally to apologize. The chairman of Senate Committee on Health, Senator Ted Joshua, he called from the United States to express his sincere apologies that he couldn't make it, but he said that he is part of this event. If it was possible for him to come, he would have made it. But Senator Mao also sent a representation, so we appreciate him and all their colleagues in the National Assembly. Her Excellency, the wife of the governor of Kebbi State, came, and she did wonderfully well. She stayed all through and made very useful contributions. We thank her. We thank her husband. We thank all the governors of the Federal Republic of Nigeria. Then the commissioners of health. You've been here since yesterday. You had a very busy schedule. You have so many things to do. But because of your commitment to Nigeria, because of your commitment to the health sector, you came and you have made your input. We thank you. Members of state houses of assembly, you traveled from long distances to this place. Some of you came even 2 days before the program. You were asking questions, what can we do? And we noticed that in your respective houses of assembly, you have been making efforts to boost the funding for the health sector. You have been making efforts to make sure we have a better healthcare systems within your capacity. We thank you, and may God continue to bless you. Then the development partners, the development practitioners, the veterans in the civil society, the full soldiers. Today is your own, tomorrow is yours, and it will be yours forever. You have to keep the flag flying. You have to keep pushing the boundary. We believe the health sector will be revived at the end of the day in Nigeria. Then the media. Without the media, there is nothing. From the beginning, they've been very supportive. Premium Times and all their associates, NTA, and Timoji was here yesterday, and she did very, very well. So we thank all the media community for supporting the health sector and for continuing. We hope that you continue to support the sector. We know there's still a lot of work to do on both sides. The civil society will do their part, and I believe the media practitioners will also do their part. Then, to those that actually put together this particular event, PTCIJ, Project Pink Blue, Ronsi, Mboho, PACFaH, we've been having sleepless nights. So, to put an event like this together, people must sacrifice. They've done a lot. We have a good number of volunteers. Without being paid anything, they were so committed. They were so passionate. This is the true Nigeria. This is the Nigeria that we all want. There is hope that this country will become better, become greater, where everybody will be happy and live well and healthy. Thank you very much for making this a very successful event. Thank you.
Thank you so very much, Dr. Fatai. You thanked every other person except His Excellency, and that will lead to reduction of your budget allocation. All right, very quickly, just a review before we take the closing remarks by no less a person than our esteemed Honorable Commissioner of Health in Nasarawa State. We'll quickly have two people, very balanced, gender sensitive, to move for adoption of the communique as amended, and then somebody will second. Yeah, we are moving as amended, as will be amended. We have to formally and symbolically make this happen. We are not going to gather again. Someone, a man and a woman. Okay, they're already here. Man, you're one. You move for adoption as will be amended, contributed, imputed, and corrected. You say your name, your organization, and you move, and comrade, you will second. Please give her a microphone. Quickly. Give her Jia. Yes, look at her.
Good evening, everyone.
Good evening.
My name is Fati Aruna Gambo. I'm a palliative care nurse, retired nurse but not tired. So I'm moving for the.
You are moving for adoption of the communique as will be amended.
Yes.
Thank you very much. My name is Musa Muazu Musa. I work for Joint National Association of Persons with Disability, JONAPID. Having been part of this dialogue for the first and second day, and also having been personally contributing to the discussion.
You represent your people.
Okay, I move for the secondment.
You second.
Okay, sorry.
You lose your ticket, you second.
Okay, I humbly second for the motion heavily raised by my sister in adopting the communique in...
As will be amended.
Okay, as it will be amended. Thank you very much.
Those in favor say aye. The nays are not here. Thank you. Let me personally, with excitement, invite the Honorable Commissioner of Health, Nasarawa State, a man full of commitment and passion, has been with us, participated in many sections of this national dialogue, to come forward and formally close this Health Dialogue 2017. Honorable Commissioner, sir, your colleague is calling you. So please, after that, we'll have a group photograph with all the partners, and then we'll have a general group photograph, and then we can depart. Thank you very much.
Following 2 days of dialogue with all stakeholders, it is indeed my pleasure and privilege to formally declare this dialogue closed for this session, but with the belief that what took place over these past 2 days will continue to be a dialogue in the nation as we go towards, as we walk towards universal health coverage. And may the Lord bless us all.
Thank you so very much. Please, may you rise for a group photograph. All the partners, the European Union Commissioner, please kindly come. Dr. Fatai, Ron Sichidebe, Project Pink Blue, Dr. Dakbo of Premium Times, and all the partners, please come to the platform for a group photograph. Please, we're also going to have a general group photograph here, so I encourage you to stay back after this. Mr. Dakbo, it doesn't matter, he will soon be a professor. He's doing more than some doctors. Okay, you're ready. Wait for Premium Times. Mboho, you should come now. You're always running away from picture. Come and join. All right, so let's have all our distinguished participants come and join our highly esteemed honorable members from National States House of Assembly. Please come, and all stakeholders kindly come. We're all just going to be here. I think we'll come closer this way. Outside. Outside will be better. Okay. It's raining outside. It's raining.